Hello, and welcome to Coffee Conversations. We are glad to have you with us today as we talk about the topic of health and safety. I want to welcome, of course, our co-host. Thank you so much for being with us all the time, Renata and Jonathan. Renata, would you introduce yourself?
Hello, everyone. I'm Renata Moy, Chief Communications Officer of the Cumberland County Schools.
Jonathan?
And I am Jonathan France. I'm the Curriculum Specialist for Social Studies for Cumberland County Schools.
And I'm Joaquina George, the Family Engagement Specialist for Cumberland County Schools. Thank you again for joining us. Today, our local experts on this topic who have been working diligently in light of COVID-19 to make sure that we are prepared, that our families are prepared, and our students will be able to be prepared when we return to the building. So we have with us Shirley Bolden, who is our Director of Health Services. Thank you for joining us, Shirley.
My pleasure.
And we also have with us Donna Fields, who's the Executive Director of Operations. Thank you, Donna, for joining us.
Well, thank you for having me.
Thank you. So we're going to jump right into our conversation. We are really today wanting to focus on health and safety. And Shirley, we know that you are our guru of health services for Cumberland County Schools. So can you talk to us a little bit about the supplies and things that we have received in order to open schools with COVID-19?
Yes, we're very fortunate that we will be able to provide each student with 5 face masks. We will also be providing each employee with 5 face masks. Now, if an employee or a student or let's say a visitor shows up to our building and they don't have a face mask, we will have at a minimum 10 surgical masks in the front office just to help folk who may need one. We also have face shields. Face shields are going to be provided for when extra protection is needed. We have gloves. Gloves are going to be in our isolation room where we're keeping people who are showing COVID-19 symptoms. And then we're going to have gloves in our reception health area where we have our routine illnesses or just general first aid or medication distribution. Mm-hmm. The last thing I want to mention as far as supplies to keep folks safe during COVID-19 pandemic are gowns. Now the gowns are being provided for use in schools when the staff member may potentially be exposed to a bodily fluid to include respiratory droplets. And that's a good overview of some of the PPE that we will be using in the school to keep families and students safe.
Thanks, Shirley. Thank you so much for sharing that information with us. And Donna, we know that there's been some supplies and things that have been necessary on the operations side. Can you talk to us a little bit about what that looks like?
Yeah, absolutely. So we've been working really hard to get supplies out to schools. So we have delivered hand sanitizing stations to be used at the bus entrance, the main entrance, and also at the cafeteria. We have delivered hand sanitizer and boxes of tissue for every classroom and office area. Sneeze guards are going out this week, and those will be used in the reception area, maybe the media center, cafeteria, cashier area. Things like that. And like we have also provided floor dots to remind folks where to stand for social distancing.
Oh, yes.
Yes, and as well as directional arrows. So we're having one-way movement on each side of the hallway. We've provided some signage, and we provided a signage toolkit that principals can also use. Things like the 3 W's, stop if you've had symptoms, that kind of thing. And then age appropriate signage like washing your hands, health etiquette, things like that. And another thing that we have provided is very, very safe, effective, and environmentally friendly disinfectant for the teachers to be available for the teachers in their classrooms and on the buses. So all of that, it's been just a moving circus this last few weeks, but we've got it all in finally.
Thank you.
That's all right. You know what, let me just ask this question really quickly of you, Donna. I guess I haven't, what was it, at the beginning of the school year, I was able to go into Walker Spivey. and I got to see their sneeze guard, and their dots on the floor. Like, do the people from our facilities, employees from our facilities department come and they put those out, or are you all handing them out, and then the school is determining the 6 feet and and where the dots should go and the arrows and
Yeah, so what we did was we provided a little bit of guidance. We left it up to the schools. And the reason being is because the schools know their traffic patterns.
Gotcha.
They know where their lines tend to form, where people may congregate, maybe up in the front office, well, they'll have to put a few dots there. We don't have dots all over the school because too many become information overload. It really serves as just a reminder. But we did provide some written guidance. I included a little tape measure in their starter kit. But if anybody did have any questions or do in the future, yes, we've gone out to a couple of schools to kind of give them a little on-site guidance, and it's worked out really well.
That's great. Okay.
Thank
you.
Yeah, sounds very thorough. Now, of course, right now, as we've started the school year, we're starting under Plan C, that fully remote teaching. And you can even kind of gather from the background, some of us in central services are fully remote from home. Some of us are coming into the building, but at some point, the goal will be to get into that transition to Plan B. And I know that we have a screening process in place, but what will that look like when students start coming in under Plan B? How are students going to be screened, and will there be screening for staff at that time? Like, how is that all going to work?
So upon arrival, the screening team, first they're going to be screened to make sure they're okay. They will wash their hands, put on their face covering, and then they're going to put on a single pair of disposable gloves. Now, students standing in line will be requested to wear a face covering while they're in line. We're going to offer them a hand sanitizer, and then they're going to be expected to maintain social distancing while waiting to be screened. Now, every parent is going to be asked to provide us with a parent attestation form. And on that form, we will be able to, staff will review that form initially. So after we review the form, we're going to make a visual inspection of the child or staff member. Now, what are we looking for, right? So when we make this visual inspection, we're looking for any signs of illness, which it could include flushed cheeks, rapid breathing. Now, not if your child just finished running around, because we know how our kids are. They will take a run. So we're looking as it relates to an illness. Difficulty breathing, fatigue, coughing, shortness of breath. So we're just doing like a quick assessment. And then the child's temperature will be taken with a non-contact thermometer. The employees will follow the same process. And so, and on we have a screening log, and we use that log to document anyone who has a positive screening. And when I say positive screening, what I mean is if they tested, a fever is considered 100.4 degrees Fahrenheit. So let's say that I had a fever, or if I said, when I was being screened, I said, oh, I was nauseous and I had muscle aches. So that would be documented. And those are kids or staff members who would be expected to have alternative telework or remote learning for the day.
Now, you know what, let me ask you this, Shirley. As it stands right now, we do have some teachers and, of course, faculty and staff who are in and out of our buildings. And some teachers are choosing to work from their classrooms to teach. They are being screened every day, correct?
That's correct. There's a screening checklist. And prior to entering the building, our goal is usually before we allow someone to enter the building, is to screen them. We want to see, since they were last at work, have they had close contact within 6 feet or for 15 minutes or greater in the last 14 days? So that's the first thing we're going to ask. After that, we say, have you come in contact with someone? Have you yourself been diagnosed with COVID-19? Has the health department or your healthcare provider asked you to self-quarantine? And then if they can answer no to all of those, then we're going to go into a symptom checklist. Have you had a new cough, a new loss of taste or smell? Have you had headache, congestion or runny nose, fatigue, sore throat? nausea or vomiting, diarrhea, muscle body ache, shortness of breath or difficulty breathing, chills and fever. If they answer no to all of those, then they are allowed to enter the building. If they answer yes, then they're going to be excluded because we want to give them an opportunity to go home, rest, and do an assessment and follow with their primary care provider.
Okay, that sounds good. All right, and that's good. I'm glad you answered that because that was what I was going to ask you about, the screening checklist and how that all works. That's good.
Yes.
Thank you.
So Shirley, we know that each school does not have its own full-time dedicated nurse. So we've talked a little bit about the protocols of going in the building and the screening team. So we know we do not currently have a full-time nurse at all the schools. So how will the support be provided for health services for students, especially with the screening and process of going into the schools again?
Okay, school nurses will be on call at all times. In addition to that, each school has 3 medication clerks. Those medication clerks are trained to manage, to assess for basic COVID-19 symptoms. They are the same folk who administer the medication daily. And we have a primary med clerk. That primary med clerk is going to be our constant. That person is there from when the first student arrives to the last student leaves. Then we have 2 backup personnel who will support their primary med clerk. And so some of our larger schools, though, have 4 or 5 folk who are trained to administer medications and respond to emergencies. So every school is equipped with staff. It is our goal of Cumberland County Schools to eventually have a school nurse in every building, and we're working towards that.
Thank you.
Yeah, so, okay, I mean, it sounds like we've got a pretty good screening process in place, but, what happens? What happens if an employee tests positive or, as you said, screens positive? What if it's a student? What kind of protocols are we going to have in place?
Okay, so if an employee tests positive, we are going to, first of all, if we know prior to they enter the building, we're going to deny access to the building.
Sure.
But the employee will be excluded from work, the student will be excluded from school. And the next step will be get all of their close contacts.
Okay.
And so we'll get their close contacts. The Office of Health Services is working closely with the Department of Public Health, Cumberland County Department of Public Health. We will share that information, and we will make sure that every close contact has been notified of their that they've been in close contact with someone who recently tested positive for COVID-19.
Wow. Yeah.
So thank you, Shirley. You gave a lot of valuable information that we know families are really thinking about. What are the next steps? What are things going to look like? So before we get to Donna and your conversations about the operations and what our buildings would look like, for families who are just joining us, thank you so much for joining us for Coffee Conversations. Our topic today is health and safety. Coffee Conversations is a part of our family engagement initiative. We have started a district-wide family engagement outreach program called Cumberland Family Academy, where we try to provide support to our families during this time of COVID-19 and moving forward to make sure that you are informed and aware and able to support your children in the best way possible. So please continue to join us for our Coffee Conversations. In the fall, you will hear us talk about our workshops under Cumberland Family Academy. So stay tuned for some great information so that you can stay informed and engaged and involved with us in helping to make sure our students receive what they need moving forward. So thank you for joining us for our Coffee Conversation. And we'll keep the topic going. So Donna, we have a lot of families who are interested in what our schools are going to look like. What's going to be the big difference? We've talked about the safety protocols and the health protocols with Shirley. Can you talk to us a little bit about some of the obvious changes that we're going to see as far as safety protocols for our schools moving forward?
Well, I think one of the biggest changes that that people will really see is, number one, the screening process. And that'll be done before anybody enters any building all throughout the day. Something else, again, the obvious thing that's going to be a big change is everybody's going to be wearing a face mask. That's way different than anything we've ever experienced before. And that will continue through Plan C as we transition to Plan B through Plan B, and then hopefully one day to Plan A, and we can take those masks off and be able to see each other's smiling faces. But until we get to that point, folks will see different signage. So on the front door of every building, the bus entry and the main entry, they'll see the reminder signage to please wear the 3 W's, and if you're symptomatic, to please stop and don't enter the building. And again, they'll see those red dots outside for social distancing, and they'll see red dots inside for social distancing. And I think that's probably the biggest thing that they're going to see. Just a lot more signage to remember, to remind everybody, wear your mask, stay socially distanced, make sure you're washing your hands frequently, things like that.
I guess something here. Yeah, go right ahead, Cheryl. Yes.
Yeah, I also want to mention about the desk facing the same direction. That'll be different where kids are used to sitting in these little groups. Mm-hmm. So we won't have them in the groups. We will have all the desks facing the same directions to reduce the spread of respiratory droplet.
Mm-hmm.
Mm-hmm. Okay.
That's something else we will be doing.
Yeah,
back to desks and rows.
Yeah. Well, they'll have some. Every classroom looks a little different.
Sure.
We are not removing the furniture from the classroom,
okay.
But what we are doing is tagging each desk. If we have 3 cohorts of students, they'll use their desk, but they'll be separated. Each cohort will sit in a pattern to where they'll be separated by at least 6 feet. So yeah, that's going to be different. Less kids in the classroom through Plan B, absolutely, and on the bus.
Well, that's what I was going to ask about, actually. Like, transportation must be a huge deal. How's that going to look?
It is a huge deal. It requires a lot of planning. And of course, we've been going through change a day, it seems like, for the last several months. But during Plan C, what we're going to be doing with the buses, if they started yesterday, they have 80 buses that are serving as I-stations. Which they will have a Wi-Fi device on it, so they'll be spread out in the community, and folks that don't have internet at the house can come into close proximity to the buses and have that access to the internet so that they can learn virtually. Buses are also helping to support child nutrition and feeding students, because they are buses that are deployed to the neighborhood feeding sites. Mm-hmm. As we work towards Plan B, this will also look a little bit different because we are also going to be limited by social distancing. So you will only have 24 students on a bus where we normally would have anywhere from 48 to 72.
Wow. That's interesting. I'm sorry, Jonathan, go right ahead.
No, just wow. you and I both. Yeah, go ahead, Renata.
Yeah, it's a lot of changes, but you know what? When you mentioned signs earlier, and then Shirley mentioned the screening stations, I really hope and pray that when people come to our buildings and we go through the processes that we have to go through, that everyone will exercise patience.
Absolutely.
And, just exercise patience, that we're going through something that we've never been through before. And I know when Dr. Conley did a couple of interviews on the morning of back to school, and he asked, grant us some grace and just please have patience,
mm-hmm.
because we want everybody to come and, at the given time, but at the same time, we have to be very careful. Now, Donna, something that I wanted to ask you is, now we have water fountains, bathrooms, and just things of that nature, facilities within our building of that mm-hmm. nature in each school. Mm-hmm. How do they look different at this point? How do those areas look different?
So the schools have already placed the social distancing dots. They've placed a lot of the signage. Water fountains will have a sign on them to please not drink directly from the water fountain. Now, folks can fill up cups and they can fill up water bottles with using the water fountains. We're just asking that they don't drink directly from. We'll also have signage in the bathrooms, again, age appropriate, to make sure kids know how to properly wash their hands, just to kind of walk them through with a pictorial. There will be red dots in the bathroom so that we can maintain that social distancing in the bathroom. And this is just kind of, the whole theme is spread throughout the school, the social distancing and things like that. We are also providing the bathrooms with more, we're refilling the bathrooms more with paper towels and soap, because of course we're going to be encouraging more hand washing.
Sure.
So
That's good. Make sure you all do it for the adults as well, you know.
absolutely.
I'm just saying,
Absolutely.
you know, and even the red dots, as adults, we have to be honest. We have been out and about, and we have people who just really don't want to say that 6 feet, you know, but you almost want to wear a body placard that says 6 feet, please, 6 feet.
I know.
Up.
Right.
You know, and part of the challenge is, you know, what we practice, we perfect.
Right.
Right.
So,
Okay.
you know, America is so accustomed to doing things the way we have. So we're going to have to get into a rhythm of doing things differently. And so we're going to, as the more we practice the change, the more we perfect the safety measurement.
Mm-hmm.
Yeah, well said. Well said. And I'll add, as this school year got started with all the questions and all the concerns, you know, parents have been calling in with a lot of those questions, a lot of concerns. But the one thing I have heard pretty consistently is just how everyone is really being supportive and patient as we all figure this out together. Because, you know,
Right.
none of us have been through this before. This is new to everybody. So really appreciate everything you and your departments are doing to help keep our whole community, because really the schools are the heartbeat of the community, and
Absolutely.
keep everybody safe.
Yeah.
And you know, a piece of that, one of the things that a lot of people don't realize is that, you know, schools aren't just about learning, like food. You know,
Right.
we feed a lot of people, and I know, like right now as we're getting started, we've got this you mentioned the buses with the remote sites for the feeding locations, the food locations. How is that working? How are food services being provided to really all our families? How is that
Absolutely.
working?
So meal sites resumed operations on the 17th. We added location and service times that align with the instructional day.
Right.
So during the spring, 16 schools were serving as feeding sites with curbside delivery. Well, now 49 schools are offering curbside pickup. And the meal distribution time is from 11 a.m. to 12:30 p.m. So during August, the free meals are offered to all children 18 years of age and under, and we're using the Summer Food Service Program guidelines to execute that. Starting on September the 1st, meals will be provided to CCS enrolled students based on their status for free, reduced, or full paying meal benefits in accordance with the National School Lunch Program guidance. So parents and guardians need to know that they can pick up meals for their children at any school, and the children are not required to be present for this.
That's good.
Okay.
I really like how, as a parent, we have that hour and 30 minutes built in where we have time to get in the car and get them there to, you know, and get the food and bring it back. I think that's, there was a lot of thought that went into that.
Mm-hmm.
As a parent, I appreciate it.
Yes.
So Shirley and Donna, you both brought us some very valuable information, answered a lot of questions that we have as staff, that we know families have as well, as they are forward thinking. What is September, October, November going to look like? So for giving us an idea of what that will look like, thank you so much. Shirley, anything else that you'd like to share with our families?
Just want to encourage families to practice mask wearing, and you know, practice washing your hands. Go to our reentry website. We have some videos and some links that can give you some guidance. Make it a contest. Who can get their hands the cleanest? I mean, there are all types of things you can do to reinforce good health habits. And that's what I would ask of each of you as adults as our middle school students, as our young elementary. We want good health habits to give us lifelong health behaviors.
Yeah.
Thank you, Shirley. Thank you. And we will practice. We will practice.
Yes. Oh, yes.
Donna, do you have any last words you'd like to give to our families?
No, just know that we are working very hard to make sure that your children are safe in our facilities, first of all. Second of all, to support the learning. So we will do whatever it takes, whatever needs to be done, we're there. And safety is our number one priority. Absolutely.
Thank you. Thank you both for your hard work. Your departments are working diligently, nonstop, trying to make sure we're ready to get into the buildings when that opportunity comes. So thank you for joining us and sharing the information. Thank you, Renata and Jonathan, for joining us as always and continuing the conversations. Families, thank you for being with us and joining us for another episode of Coffee Conversations. Please join us next time and make sure that you bring your coffee and we will bring the conversation. Thank you so much for joining us and have a great day.